Okay. Okay, the glass, we are going to be setting up leads, which we use these to do the EKG. So we have to make sure they are put in the correct placements. So right now we're gonna go through placing the electrodes. First of all, you want to provide for privacy for your patient, and you want to explain to them what you're going to be doing. Good morning, Mrs. Smith. Today I'm here to do an EKG on you, and I have to place these electrodes on your skin. So you need these electrodes, and you need some type of gauze that is going to be used as an abrasive in order to remove excessive oil or just excessive dry, whatever you need to be to make sure the skin is clean, and then make sure that these are going to stick. So what you're going to do is you're going to go to the lower extremities. Now, for this, when you're starting with your electrodes, you're going to put them on the right leg first. Avoid putting it over a bone or a scar or any area that is not smooth. So first of all, you're going to move to the inner aspects of the leg. You're going to rub and clean it, and at that same time, you're going to be putting your electrode. Place your electrode to the inner aspects of the leg with the tip pointed upward toward the body. Next, you're going to take the second electrode, come lateral from the bone, find another area on the lower extremities, and put that electrode in place also. So right now, you have covered putting the leads on the lower extremities. Next, we have to go up to the upper aspects of the body. These leads, electrodes, can go on the arms or the anterior chest wall. A lot of times they avoid putting on the arms because if the patient moves, it can alter the effects, of the EKG. So for today's demonstration, we're going to locate your sternal notch. It's this area right here, and come down toward the clavicle bone, and that is where you're going to be putting those electrodes. So first we're going to clean the site on the right chest wall just below the clavicle, and you're going to put your lead in a downward position. With the next lead electrode, you're going to clean to the left side of the chest wall and put down your next electrode. Then you're going to still be providing for privacy of your patient. You're going to come down. This is the area right here, which is the Lewis, angle of Lewis, the sternal border. Come down to count your ribs to your second intercostal spaces. On the right side of your chest wall, second intercostal space, you're going to clean that surface, and this is going to be where you're going to put your V1 lead. To the opposite side, to your left chest wall, just across from your V1, same intercostal space, V2, you're going to put your V2 lead. Then we're going to come around to the left side of the patient's body, still providing privacy, clavicle, mid-clavicular line, fifth intercostal space, and you're going to clean that area and put V4. Okay, next you have V3 that is going to lie just between V2 and V4. You're going to clean that area. And this is where you will put V3. Next, that you're going to look to make sure that you align with V6, which is going to be mid-axillary, just below the armpit. This is where you would place your electrode and clean off the surface area to put V6. Okay, now we're going to do the placement for V5, which lies anterior axillary, You're going to clean in that site, and it's going to rest and lie between in the fifth intercostal space between V4 and V6. That's where you're going to place V5. Okay, so now you have your placement for all your electrodes on the patient's body. Still providing for privacy. And now we're going to move on to connecting the EKG machine. So in our next video, we will demonstrate connecting the EKG machine. Thank you.